Welcome back for those of you who have seen any of the other podcasts that I have produced. And if this is your first one, I really want to appreciate and thank you for joining us on a journey. For me, leadership is the core of what is and what can be for any organization. It serves, as its foundation, no question about it. And it's formed and built upon the right competencies exercised in the most correct way. And it's really having the courage to guide people. And I know that may sound a little corny, and I don't mean it to be. But if you are a leader and you have the competencies to do what you can do, I always see it as a leader, it's our responsibility. It's my responsibility to do the best I can to guide the people that I am working with. And, it takes moral character. It's the bottom line. If you want to do it the right way. And when you do, you will move those organizations and your teams to heights they could never imagine because you see it. And it's your responsibility to help them see it, believe in it, and achieve it. I believe those three words, see, believe, and achieve, are the best of what we can be. So this series is using my book, Leading for Value, into 4 chapters, broken down by basically elements in each chapter and the tools, the leadership tools that I have created or referenced from other people with great strength and use those. And in this particular session, this is episode number 10, hard to believe. But today, what we're going to be dealing with is a continuation of the strategic planning model that I had in the previous one. And I'm going to go ahead and share my screen so we can get started. And the purpose of today's session really is to take a look at that and then apply certain elements of it to what we call a decision grid and then the can and cannot control. And these are all parts of the process that you as a leader, and I know many of you have been in leadership positions and executed strategic plans. I understand that. So this may be a little repetitive for you, but my purpose here is to show you and give you my perspective on what this means in my context as I see it and why I wrote the book the way I did. And I will tell you that most of the tools, in fact, all of them and the models are based in the formation of what works in a healthcare system. But I can guarantee you, having consulted in financial services, both at the national level and a local level, as well as a company in the oil industry, that was Starcon International, a great group of people. And we took that company to heights that I was just amazed in 7 years. It was wonderful. And so a lot of the tools that I'll be providing you are as effective in virtually every kind of industry that you want. It really doesn't matter. It's how you adapt it to that industry and the organization you're working with. So today we're going to sort of pick up on what does it look like, the priorities and planning and measuring impact. And you can see those are the last 2 of 5 boxes in that quote unquote strategic healthcare planning model that we used, my colleague from Brandeis University with the Robert Wood Johnson Foundation for 13 communities that were doing something very special to help guidelines and provide pathways for older adults to better navigate and get benefit from their healthcare systems. So the first one is very simple. It's a grid with criteria, the various strategies involved, and a scoring mechanism, basically 1 to 5, 5 being the highest score, 1 being the lowest score. And this is the kind of grid you would use with a small group activity, a productive dialogue, taking each strategy in order as you want, and then first defining what are the criteria we're going to use. And what I recommend is you put them in sort of rank order. So in this case, it's quality of service, continuity of care, funding support. Not that it's not important, but it's down below the other two. And then the 100% of agencies involved. And those are the stakeholders in most every industry that you have to work with in order to be very successful as a leader. And we in this case, we want 100% participation. And then lastly, in this case, we use the threshold as 85% of the clients are covered. And it's a rather simple process. You have the group in a group discussion talk about each strategy by the category of the criteria. And then they do their own individual work, say in small groups, and then they combine together and reach consensus. So these scores then represent the consensus. And the idea is to try to see, can we differentiate between, in this case, 4 strategies? In this case, strategy 1 and strategy 3 have the highest scores, 2 and 4, the lowest scores. And the purpose behind this is to sort of say, okay, are there any strategies we need to set aside and eliminate for the time being because they're really not going to be effective or easily implemented in such a way that we will get the benefit and the people we're serving will. And then the idea then is to take strategy 1 in this case and strategy 3 and pick either one or both and say, okay, we're going to develop a plan to execute those in such a way that they are very effective. So, as a consequence, very straightforward, use a small group activities. And as a leader, what you really want to do is pay attention to the people on your team to see, are any of those possessing extraordinary expertise that I want to make sure that they get their full 2 cents worth in on the discussion. And then to make sure that they don't dominate as well. But the whole idea is to use that group approach to move forward as best you can. That's the grid. The next one is what I'm referring to as contingency thinking in this case, can and cannot control, proactive and inactive. And this tool is a very, very effective tool as a guideline for discussion. I'll give you one quick example before we get into the details. During one year, I was pleased to be able to be the substitute faculty at the U.S. Postal Service Leadership and Education Program at the Bolger Center. And that was the year, coincidentally, that the Postal Service had just signed a major strategic contract with FedEx. And unfortunately, I don't think they did the best job implementing it and getting their leaders on board with the purpose and the goals. And as a consequence, what was happening is there were a lot of butting of heads up against the brick wall. And they were looking at things that they were supposed to be doing or they thought they should be doing and can't do because they didn't have the capacity to be able to pierce that wall and get it done. And so what I did is I spent most of my time helping them to understand in those things that you think you're going to be proactive and you don't have control, you have to make a decision. Is it really worth all the time and effort to try to keep producing or pursuing that strategy when it's not working? And we worked on that quite a bit, and I think we were pretty successful in getting those folks understanding this whole model, and I used that effectively with them. And it's a great leadership opportunity because as a leader, you can begin seeing how does my team interact with the environment we're in? What do they see? And what can I gain from that? Because my job as a leader, I've got to facilitate and guide. And my purpose is to try to get the best we can possibly get as an outcome and minimize the wasted time and effort and resources. Because in some cases, you may be scarce resources in implementing. So the idea here is to get them to take a look at things so that we don't make the wrong decision and therefore waste our time and efforts. So let's sort of go through this. And I'm going to tell you first, The four quadrants, if you're proactive and you can control, those are the things you can leverage and move forward. And that's a good one because those are the things you want to pay a lot of attention to and take full advantage of that opportunity. Those may actually, in some results, actually bleed over into other areas that you may not realize and help you uncover opportunities to do things in areas you don't think you have control. And so if you're proactive and cannot control, like the Postal Service was having with their FedEx contract, don't waste your time. Set it aside. Don't waste your time. And some things you can control and you're inactive. What we don't want to do there is fail to see an opportunity to leverage that strategy by giving up. We want to exercise it and move it forward and not give up, because when you give it up, you're then losing an opportunity that you don't want it. So then let's go down to you're inactive. You think you ought to be inactive. You cannot control the environment or the area. And therefore, it's best to say, okay, let it go. Don't think about it. Let it go. And then come back periodically and say, are we still letting it go? Because it is important to revisit those. And so as a consequence, what you'll end up doing is you'll be filling in these various quadrants with the strategies of where you think they fit best. And then you work from there to implement and game the plan that you want to achieve in the long run. So let's take each one of them very quickly. Proactive and can control. Again, these are the key elements of a strategy that you're looking at. In this case, it was either one or three. And you want to leverage those to your benefit. And it takes an opportunity for some dialogue, because people on your team will know what you can do and what you can't do, given the areas for which they are responsible. And you want to know why they're better and more effective, and what are the key factors that make that decision very positive. And you want to make sure you take full advantage of that. So that's it. And in the case, the last point there, the key contributors, if you're doing something that's involving the community, in healthcare, for example, your effort, say, on cancer treatment might involve a number of different stakeholders in the community for which you are going to be needing their assistance in order to support your effort. And so they become key stakeholders. You want them to have a full sense of ownership so that they can help you in making that happen. And so that's moving forward, proactive and can control. Let's go fast forward. Proactive, cannot control. As I said earlier, you're butting your heads up against the wall. You don't want to do that. You don't want to waste your time. So as a consequence, take whatever those strategies are or initiatives you're pursuing and set them aside. And then perhaps towards the end of the discussion, go back around again, say, let's just test it one more time and see if that's appropriate. And this is a good opportunity for leaders to look at their teams and see, how are we accepting the reality that we're in? And let's face it, in some cases, it may be a lack of funding. It may be a lack of interest in some of the areas that you're trying to pursue. And as a consequence, you want to make sure that you have a good sense of what that reality really is. If we go down to the lower right-hand quadrant, cannot control, and we're inactive, again, this is one where just let it go. Set it aside and let the scenario discussion that you're having jot down some of the key reasons of why you want to stay inactive and you cannot control the area, and therefore we're going to let it go. And I think that's an important one, because you obviously don't want to end up with a false negative, meaning you're letting it go and you shouldn't. So that's always in the back of your mind. And as a leader, you can do that periodically by interjecting, okay, so let's just look at this one more time. And that's an important component. And the last quadrant is we're inactive, we can control. And I label that giving up. And what I mean by that is from our thinking and the discussion we're having, we may jump to the false conclusion. We may be giving up and we're not paying attention to something in that strategy, in the implementation that we're looking at and how we're going to monitor it, may be something very valuable that we need to pay attention to. And in that regard, we don't want to give up. So the big question there is, if you're no action, then you're losing an opportunity for some real value. And in the case of healthcare, that can be very important. Very important. Clinical pathways that you're looking at for cancer patients, trying to get them in and participating in cancer treatment, early detection and treatment, absolutely critical. You don't want to give up. And I know that my colleagues, the one in particular, Raluca Simbotin, she is with Merck Stark Dome, the drug company in Romania, and they're doing some very exciting work. And she's leading the effort for the company in early detection and treatment for cancer. And cancer is a major focus in Romania right now. And I think in some other countries it should be as well, because heart cancer, stroke are the leading causes of death in virtually every country in the world. So my hat's off to Raluca and her team. She's a great leader and she's doing an excellent job. And I see that in other things. I saw that with StarCon International. Those people there were fantastic and they wouldn't give up. So what are the leadership opportunities in this regard? It's all about the productive dialogue. It's a combination of both critical thinking and creative thinking. It's an opportunity to take advantage of the technical factors and the skills of your team and bring them together and help them influence the group in making decisions about what we're going to pay attention to, what we're going to implement, and how are we going to monitor it. And it also allows time for the leader to take a look at his team and saying, do I have some folks on my team who I could see 5 years, 3 years, 8 years from now could be operating in key leadership positions that they're not in today? And that's an important part. Jack Welch said that his job wasn't running the company. His job was to find the next person who was going to replace him. And I had the pleasure of meeting and hearing him speak and talk to him a number of years ago when I was with Sun Health, a hospital alliance, and we had a meeting in San Diego, and he was the speaker. It was like a small group setting, and it was fantastic. I learned a lot from him. And so as a consequence, for leaders, it's your job, our job, to further that development of trust, capitalizing and demonstrating your own trust of them on their capacities, capabilities, and competence. I guarantee you, if you do that, you won't lose. You're going to win, and you're going to win as a team and the whole group of the organization. So that concludes episode 10. I wanted to get those two tools out in this one, and I hope you enjoyed it. I hope you found something of value. And the next episode, we're going to talk in further detail about what is a competency-based leadership model. That is absolutely critical, and we're going to be dealing with that in episode 11. So thank you again for being part of episode 10. It's always my pleasure, and I welcome any feedback you might have on the comments. If you like it, please note so. And my podcasts are listed out at podbean.com and also in YouTube and LinkedIn and a number of other sources like Facebook. So you have other ways of finding them, and they are both video and audio. That's very important. And when I can attach something as an attachment, like a PDF, I will do so. But again, thank you very much. It's my pleasure to have you here, and I hope to see you soon. And best wishes to you and your own leadership journey. I really appreciate what you're doing. Thank you.